So, hello friends, this is Dr. Ashish Taneja, and today I've picked up a topic, orthobiologics. This is that might be asked in your theory questions. It can be asked even in some short cases as well. So, it's the new thing, so it can come as recent advances as well. So, and try to give you a comprehensive overview about orthobiologics here. So, let's start. So, first of all, this is the new uh, branch of orthopedics called regenerative medicine. So this is an umbrella term that describes an area of medicine focused on using cells or proteins derived from human body to treat, repair, and regenerate human tissues. So that is what regenerative medicine means. And orthobiologics are some things which we use. They can be organic, that is produced from the body, or synthetic, that can help in cure of musculoskeletal problems and are utilized both in and out of the theater to augment the possibilities of curing bone and soft tissue lesions. So that's what orthobiologics are defined as. So what they are trying to do is they will try to decrease symptoms and promote the chances of healing of tissues which have little intrinsic healing ability. Especially where we work is cartilage, on non-unions, tendinopathies, ligament injuries like ACL or cuff tears, muscle injuries, and meniscal repairs. So all these tissues which are slow in healing or unlikely to heal, there we try to improve their healing ability. We try to improve their intrinsic healing potential by adding this orthobiologics. What all do we have available? We can have osseous hollow fillers, like we'll have bone grafts which can be used to fill up the bone defects. They are termed that osseous hollow fillers. They can be extracellular matrix substances, PRPs, which are most commonly used these days just because they're easy to make and they're economical as well. Then BMPs, they're very effective but very expensive. So that's what inhibits their usage. Bone marrow aspirate and bone marrow concentrate, bone marrow aspirate concentrate, BMAC. So both of these are very good, but again they involve aspirating the bone marrow. That is the additional procedure and is usually done in OT itself. And then there are stem cell therapies. So how do we get PRP first of all? For PRP, normally we will take blood and we will centrifuge it. Different uh, companies will have different procedure or different protocols for centrifugation. Eventually, we'll have the blood centrifuged into three parts. The first part will be platelet poor plasma, the yellow part. Then there will be the brown part or the buffy coat as we call it, which is the PRP. That is where the main concentrated PRPs are there. And the last will be the red blood cells. They are more focused in this region. This is the PRP region. This is what we want. It can be a leukocyte rich or a leukocyte depleted PRPs. Both can be used. How do we label it as PRP? In that case, the platelet count should be at least 3 to 5 times the normal value. When this concentrate is 3x or 5x of normal platelet concentration of the blood, normally can even go up to 7x. So we call it PRP when it is 3 times or 5 times concentrated at least. So what do we have in this? These platelet growth factors. Which all growth factors? PDGF, platelet derived growth factors, FGF, fibroblast growth factors, epidermal growth factors, VEGF, vascular endothelial growth factors, and TGF beta. So these are the main growth factors that are present in PRP. Other substances are also there, but these are the main growth factors which are essential for their healing potential. These are all released from the alpha granules of the platelets. So this is what you should know. Then we have to know about stem cells. Stem cells are mainly undifferentiated cells which can replicate and they can convert into different cell lineages. There are pluripotent stem cells, which means they are immature, but they can themselves into different cell lineages depending upon the surrounding. If you are putting stem cells in a bony surrounding, it will turn into osteophyte or osteoblast. If you put it around the cartilage, it can convert into chondrocyte and so on and so forth. Normally, they can be obtained from bone marrow, mainly from posterior iliac crest, or from adipose tissue, or from amniotic fluid. So these are the three main sources of stem cells: bone marrow, adipose tissue, and amniotic fluid stem cells. In general known as mesenchymal stem cells. Okay. So as I said, they are multipotent and they have shown in vitro capacity to convert into different cell lineages. Understand, this is in vitro. In vitro, they can convert into different cell lineages depending on the environment. However, when we inject them into an injury site, their conversion to different cell lineages is not as good. However, they help in augmenting tissue healing by sending out different hormones and helping them converting other cells into the different lineages. So they release something called exosome, a which is a vesicle filled with local growth hormones, which helps in regenerating the tissue injury site. So for bone healing, we have bone grafting, we have cell-based therapy, that is bone marrow aspirate concentrate, the stem cell therapy, we have PRPs, and we have growth factors. Main indication in bone healing is atrophic non-union. And we know the gold standard is still autogenous blood grafting, bone grafting. So still the best way to increase the healing potential will be to use autologous bone grafting. But the problem with it is donor side morbidity. To avoid that morbidity, different orthobiologics have been introduced, and we have seen good results with these as well. So these can be avoided in some cases. Why autologous bone grafting is the best is because it has all the three features: osteoconduction, osteoinduction, and osteogenesis. It helps in all the three uh, processes of bone formation. Currently, we use BMAC along with demineralized bone matrix, and BMPs or PRP are also available. So these are the different available options in place of bone grafting. We should know about these features in detail